Hello, everyone. Welcome back to the Dear Future PharmD Talkshow, where we feature a pharmacist and a pharmacy student as guests sharing their experience and stories with animations. And hopefully, by the end of the episode, you will be inspired to become the best pharmacist out there in the future. For our very first episode, we featured two of my very close colleagues that I worked with in the past year. We have Dr. Micah Hata, who is an associate professor of pharmacy practice and administration at Western University College of Pharmacy and a community practice advocate, always practicing at the top in community settings and always active in calling for changes for a better pharmacy. Dr. Hara, would you mind saying a quick hello to the audience?
Hi, everybody. Glad to be here.
All right. We also have one of his students who came from UCI as an undergrad and has been rising in her career. We have P2 student Nancy. Nancy, would you just mind introducing a brief about yourself and also welcome to the show?
Hi, everybody. My name is Nancy. I'm currently a second year at Western. I graduated from UCI as a pharmaceutical scientist major in March 2021.
All right. Without further ado, let's get this started. All right, Dr. Hada, would you mind first introducing about your journey in pharmacy?
Sure. I guess my journey to pharmacy started out after undergrad. So, I went to undergrad at UC Riverside. And I think I always had maybe aspirations of going to medical school. But I think during that time, I also wanted to check out other different health professions. I actually graduated with a computer engineering degree, but by the time I graduated, I knew I didn't want to do programming or engineering. So I wanted to get back into um, looking at something in the health profession field, and I just didn't know what. I think I had looked at some of the other health professions, and it seemed like the one that had a good amount of patient interaction was pharmacy. I followed along a pharmacist that was doing ambulatory care in one of these large health systems, and really got to appreciate the education that she was able to provide to patients, and the time that she was able to spend with them, explaining to them how their medication worked, what to look out for in terms of their medication, how to be adherent to their medications, and how their medications were going to help them. So that got me really interested in pharmacy. Um, Ended up going pharmacy school at Western University of Health Sciences, and got my PharmD degree from there. Never would have imagined at that time in my first couple years that I would have gone into academia. I did take a teaching elective rotation, but even then, I don't think I saw it as a career. I think it was still my career goals were to end up in either community pharmacy or AmCare pharmacy. After graduation or right before graduation, started applying to residencies, and at that time, Western U was starting a community residency. And I think what I appreciated about community pharmacy was the relationships that you get to build with your patients. They come in once a month, maybe once every 3 months, and you really get to know who they are, which is different from inpatient or hospital pharmacy, right? Where your goal is to hopefully not to get to know your patients too well. Hopefully, they get out um, of the hospital in a couple days, and hopefully, you never see them again, right? Like, hopefully, they don't get readmitted. But what I liked about community pharmacy was really the relationship building aspect of it. And the challenge, I think, with community pharmacy is that uh, a lot of it is focused on dispensing. When I graduated, that's how it was. I think even now, a lot of it is about tied to this product, the medication. Whereas in pharmacy school, I was learning about how to do clinical interventions, like how to help patients lower their blood sugars or how to help patients get their blood sugars under control. And none of that was being applied in the community pharmacy setting. mainly because there's not a lot of payment or reimbursement for those services. So what I did in my residency, after I graduated and I did my residency here at Western U, was to really look at payment opportunities for those clinical services. And I think that's a lot of what I still do today, um, because there hasn't been a lot of advancement or progression in that area in community pharmacy. Um, Within the last couple years, we're starting to see some movement, and I think that's what I appreciate about what I'm doing now. And I guess how that parlayed into academia is, when I was finishing up my residency, it so happened that Western U was looking for faculty with community pharmacy expertise, and somebody that would really want to get into finding ways to get community pharmacies paid for these types of services. And so um, I thought it was a good opportunity to try to push pharmacy in that direction and to help pharmacies figure out how to get paid for these services. And so, as a part of my academic position, that's what I do. I try to work with pharmacies to get them paid for our services. I do that at a couple practice sites right now. One is at our pharmacy on campus, and one is at a chain pharmacy. And in both settings, we look at how do we integrate clinical services into the community pharmacy practice, and how do we create sustainable models of payment for the implementation of those services.
Thank you so much. It definitely sounds, have a lot of challenges along the way, and like seeing what you're currently doing right now and how much of an impact that has, it definitely speaks for itself. Nancy, would you mind describing a little bit about your journey in pharmacy so far?
Can you guys hear me? Okay. Um, so my pharmacy journey is a little bit different from Dr. Hata's. My pharmacy journey started in 10th grade, when I got pneumonia, and I come from a family that believes in self-care, meaning like they don't really rely on medications, they just rely on drinking a lot of fluids, getting a lot of rest, that type of stuff. But obviously, in the case of pneumonia, that's not possible. And so in 10th grade, I missed about a week of school when I had this, and I finally went to um, my local urgent care where a nurse practitioner prescribed me Tamiflu. And that's when I went to my local Walmart and picked up the medication. And within about half an hour of taking the medication, I felt a lot better. And that's what sparked my interest of understanding how medications interact with the body. And so I decided to apply to be a pharmaceutical sciences major at UCI. So then I got in, and um, going from high school to college, I thought there were only two avenues of pharmacy, community and hospital. And I wanted to broaden my horizons and really understand what I was planning to invest my future in. And so I joined the Pre-Pharmacy Society at UCI, and that is the beginning of everything. That's how I learned, I would say, about that's how I got like 90% of, I guess, the qualifications to even enter pharmacy school. And that's where I got to network. That's where I got to go to school trips. That's where I got to talk to school representatives. Um, that's how I got my jobs in undergrad. And yeah, so kind of jumping back. So my first year, I joined the organization, and I got to kind of dive in and see what was going on with the club. And I was like, wow, like I really want to be a part of this. And jumping into my second year, I became a board intern for the organization. I was heavily involved. And during my second year, I also um, applied to be a technician at CVS, and I also applied to be a Cope Health Scholar to get my inpatient pharmacy experience. And then I think just after that, as I got more experience, I started to understand what I was looking for in the future, and um, I started to network more, and then I eventually applied for pharmacy school, and I actually only ended up applying to Western, and so I got into Western, and basically now I'm here. And um, as far as my professional interests go, I'm currently interested in managed care as well as psychiatric pharmacy.
Thank you, Nancy, for describing about you being sick at first and now really much inspired to help the people who are sick, the patients out there, and truly like I think that can be relatable to I would say a lot of some of the students, um, you know, trying to go through pharmacy and really getting the chance to help people out there where once they were the ones that got help.
Mm.
So moving on, Dr. Hara, just like to ask you, right? Since you have so much, experience within community, what was a memorable moment during your practice at a community setting? It could be like even during your rotations as a pharmacy student, or your residency, or anything else like you currently see as a pharmacist.
Um, I don't know if like a particular moment sticks out, but I think just in general, what sticks out to me, and I kind of referenced this earlier, is um, that relationship building aspect. So um, at one of my practice sites, um, we have a anticoagulation clinic, and so this is where we have patients who are on a medication that prevents their blood from clotting because they're at higher risk of getting blood clots, whether it's a clot in their leg or to prevent that clot from moving to their lungs, or to prevent a blood clot from causing like a stroke. And so they're on a medication that requires close monitoring. And so in our clinic, we're able to monitor by doing a blood test and then adjust their dose, either increase or decrease it, um, identify any potential drug interactions that might affect how that medication works, um, and um, really manage that condition as well as the medication. And because these patients come to us almost on a monthly basis, sometimes a little bit less frequent, and a lot of these patients are on this medication for the rest of their life. You really get to know these patients. So, we have patients that have been a part of our clinic for several years. And so we'll talk to them, not just about the medication, but we'll get to know them, things about their family, things about their hobbies. Um, and so some patients have invited me to, their birthday parties. Um, and some patients will come and, bring us food. And so it's a really neat experience to see how we kind of become a part of their lives, and how they appreciate, the level of care that we're able to provide to them. So I think, you know, even though like a lot of what I do could be considered, ambulatory care, we operate this clinic out of our community pharmacy on campus, and so um, I think that's the part that really sticks out to me in terms of being able to help patients and get to know patients in that way.
Yeah, definitely sounds great. I can see like, you know, just by being able to have those interactions and being able to see those patients every day, talk about anything. It's just, very much I think what the core of pharmacy does is well what a lot of people who are like really want to try to find a healthcare profession for themselves, and see that being able to have the chance to talk to the patient, to interact with the patient like the most. out of most professions, I think is truly fascinating, and I think that's why a lot of like people who want to join in pharmacy fell in love with pharmacy at the first place because of those interactions.
But Ryan, I just thought of like one more kind of memorable moment that stood out to me. Um, so I think because of my experience in community pharmacy, we do a lot of vaccinations, and I think one thing that stands out recently, right, was with the pandemic and us as pharmacists being able to really contribute, I think, in a meaningful way um, with the the vaccinating people around us, people in our communities. And so I think both as a part of like not specific to my practice site where I'm at or specific to community pharmacy, but just related to the level of experience I have in pharmacy as well as with providing vaccines, and then also as a part of my academic position because it's a little bit more flexible. When the pandemic came around in Orange County, they were looking for some support with running the county vaccine clinics. And so I had the opportunity to participate in our very first Orange County clinic that was run out of Disneyland. And I think that was a real, yeah, meaningful experience to be part of that. I went to Disneyland the other day with my family and just walking around that parking lot and being like, oh, this is where we set up shop to administer all these vaccines. And there were like thousands of people coming in on a daily basis. Initially just lined up, and we were providing vaccines to them. We were helping with the storage and the management of that inventory, as well as, we brought students on site to actually help administer the vaccines, and then to monitor those patients that had received the vaccine, provide them with education, and just walking around, um, just being grateful that we're able to participate in these activities, like go to Disneyland now because we have a lot of people that were vaccinated. I was just thinking like a lot of these people probably don't even realize the impact that all of us, not just pharmacists, but I think pharmacy was a big part of it, had in terms of letting us get back to some sort of normalcy, right? And it's like, oh, like people don't have to know that I was a part of that, right, and helped to run it and coordinate it and manage it, but just just knowing that I was a part of it for me personally, right, is something that I think felt, you know, um, yeah, pretty memorable to me. And I think for our students that got to participate in it too, I think it was like a real unique experience. And not that I want that to ever happen again, but just for all of us to know, oh, like we contributed to this. I think was something that, yeah, I'll just always remember.
Yeah, Dr. Hara, that definitely sounds fantastic. I think when I was part of the clinic, just doing some non clinical work at the time. It was like after the what you did with in Disneyland, but I think I was still able to see the impact that you and Jackson provided at the time. So I think definitely very helpful in my journey as well. Yancy, do you have like any particular thoughts on it, or do you have any like experience of like maybe doing vaccinations in a community setting like that really like made you thought it's like, hey, this is like the impact that pharmacists are
Mm.
making out there right now?
Yeah, so I think Dr. Hata brought up a really good point. I don't know why that didn't occur to me. Um, I feel like the whole vaccination was like a fever dream. But I think due to the pandemic, I think it permanently um, kind of altered our role and uh, the expectations that people have of pharmacists now, especially in a community setting. Um, we're always actively administering vaccines, and like people know to come to us for that stuff.
Yeah. All right. So going back to you, Nancy, is, you know, you have, I believe you have a couple rotations already, at like a community setting or anything like that. Was there's it doesn't need to be like super duper like, you know, memorable or anything, but was there something that really helped you solidify or understand what um pharmacy was like during your time at Western? Or is there anything that's what like Dr. Hata talked about? You see how the clinic operates and how those things move along.
Um, the moment that I can think of right off the top of my head was it was during my community rotation during spring quarter, excuse me, spring semester of last year, and it was at Rite Aid, and it was my first consultation, and I totally messed it up. It was through through a drive-through, and I even had notes with me, and I just completely butchered it. It was just like a few consultation notes on like what's a consult about when this patient is taking amoxicillin and stuff like that, and like what to be aware of. And I I asked the person who I was talking to be patient with me because this was my first time, and she was really nice about it. But from that experience, it just it just made me think from a patient's perspective. If their healthcare provider doesn't seem confident in what they're doing, realistically, I feel like the patient has no desire to take their meds or to even trust their healthcare provider in anything that they're saying. So it just it just inspired me, it just motivated me to do better in the future, and I did.
That's great. That's great to hear. And I think that's all we're thinking about, like,
Mhm.
right? Just keep on improving yourself. And, you know, with the support of your school or your program or even the preceptor at the rotation site,
Mhm.
right? Isn't that part of the journey? Like I think we should all go through in becoming a pharmacist. Moving on, just want to, you know, ask about Dr. Hara, you came from Western as a student. Now you're being a professor to teach them, uh, your students on like the practice about the practice of pharmacy in general. How is it like? Like, how does it feel like seeing that you yourself now is making an impact, um, in terms of generating the next generation of pharmacists at your institution that you were once came from?
Yeah, right. I think that's a good question. I think because I graduated from Western, I have a lot of investment in terms of um, the students that we produce that go out and represent Western once they graduate, or even as students once they go out there on rotations. And so I think because of that, right, I put a lot of time and effort into um, you know helping students be successful. I think that's in the classroom and outside the classroom. I feel like as a student, like our expectations of pharmacists has increased from when I was a student. Um, I think what pharmacists are able to do clinically, I mean, just because there's more drugs too, but also just what pharmacists are able to do now in terms of managing more conditions, and being involved at a higher level in terms of working with other providers. I think then also, our expectations of students increases as well. And so I think for me, right, it's um, yeah, like I feel a strong sense of pride in terms of what our students are able to do and accomplish. And I think whatever I can do to help them be successful, like that's what I want to do. So both inside and outside the classroom. So that means like, leadership opportunities. If I can connect them with other pharmacists that can help them to be successful, I think I want to try to do that for our students.
Yeah. I guess going back to you, Nancy. Relating back to that Western experience, like how did you first met Dr. Hata, and what kind of impression did he give you, or like were you like scared or anything? I know Dr. Hata can sometimes, you know, really doesn't really care about his students, that's for sure. So was there anything that you feel like, oh, it's like now I know about you more. It's like it feels like, yeah, you feel like more suited in terms of the like environment at Western.
Hopefully, I don't
I
come across intimidating.
No, I feel like I've known Dr. Hata for all of my adult life, like starting from BCI, actually. I'm pretty sure he like gave a talk like when I first got admitted, and that's how I got exposed to him. And um back in undergrad, I thought Dr. Hata was this like untouchable person and like the epitome of success. I still do think so, because he was involved in everything and even as active and always trying to help pre-pharmacy students. And yeah, I get to work with him a lot more now that I'm at Western. Um, I don't think my opinion of him has changed. In fact, I think it's a huge privilege to work with him. And when I get to work with him, he's so incredibly passionate about what he does. And I think that inspires me to like want to do like a really good job to not only impress him, but also impress the students that I'm trying to help.
And Ryan, I guess I'll add, right? Like for me as a student, like and because you're talking about comparing my pharmacy school experience to like now is I wasn't involved in student orgs or other extracurricular activities as a student. Like I would go to class and go home, and like I didn't even get to know a lot of my classmates, which I wish I had gotten to know them better. Um, but but now what I tell students is like there's so many opportunities out there outside of the classroom, right? And you just have to take advantage of those opportunities. And so I guess like what I want to try to do is expose my students to those opportunities. Um, and I guess that's why I kind of try to get involved in all these different things. One is because I think, just as a lifelong learner, I see that I learn a lot by participating in all these other activities, whether it's, other community um, committee meetings related to like prescription drug abuse or county immunizations or other professional associations like the California Pharmacists Association. I feel like I get educated, but also I feel like being involved in these different things allows me to expose students to these other opportunities. And so like that's something that I try to encourage our students to participate in. And hopefully, right, what I'm able to do is not be too busy where I can't help them be successful in taking advantage of those opportunities. Because I work with a lot of students, I think that's one of my concerns is like, like maybe I'm not able to devote enough time to each of them. But I hope, right, that I can be there as a resource for them, um, to say, hey, like, you want to get involved, you want to check this out, like here's how we can help make that happen.
So, to conclude our first episode, any words of advice for the pharmacy students who are watching, Dr. Hada?
Yes, I think I have a few. Um, I think kind of related to what I was talking about earlier in terms of taking advantage of opportunities. I think sometimes pharmacy students will get so focused on their classwork and getting good grades, which is important, right? That is important to make sure that you understand the material that you're learning in class. Um, but I think to also build up some of these soft skills and take advantage of some of these other opportunities that you're not going to get just by studying, for an exam. So taking on these leadership opportunities, networking, um, I think those are also really important. Um, you find out more about yourself when you take on some of these leadership positions. Like, what are my strengths? What are my passions? What am I good at? What do I enjoy doing? How do I work with people? How do I resolve conflict with people on my team or on my board? So I think a lot of those are good learning skills that you don't get if you just stick into your own bubble and just are focused on getting good grades. Um, the other thing I would say is, don't be afraid to ask for help. So I feel like some students, are hesitant. I mean, I find this in myself too, right? Like, I don't want to bother anybody. I don't want to trouble them. If you look at, I don't know, maybe somebody might like me and, oh, like, Dr. Hata is so busy, but I'm always encouraging like students to reach out, right? Don't hesitate. And maybe there are opportunities where I can help. Maybe there are opportunities where other students can help you out. So I would say, don't feel like you're on your own on an island and you have to do all these things yourself. um, I would say, like, looking at Nancy, like, she's a prime example of, somebody who takes advantage of these opportunities. And I would, tell Nancy, like, make sure you balance that with, school, as well as taking time for yourself in terms of, your own well-being, and making sure that, you're doing things that are fun, and that you enjoy doing. Although for me, like right now, like some of those things that I enjoy doing are related to some of these other things that I'm involved in, right? Like whether it's working with students, working with other professionals, on some of these other initiatives, outside of the classroom, like some of that stuff, because I know I'm making a difference and because I know I'm helping other people, like that's stuff that I get a boost out of, that I enjoy doing. So I would think those are probably like the biggest things that I would tell students, right? Don't limit yourself, during your pharmacy school experience. Try to take advantage of these different opportunities, and who knows, by taking advantage of these other opportunities, maybe you'll find different career options or different people who can help you along in your career, um, that are related to pathways that you would have never known that you would have, um, pursued or enjoyed doing. And so, yeah, I would say those are probably the key things.
All right. Nancy, do you have anything to add on?
So going back to what Dr. Hata said about maximizing those opportunities that are given to you, in my opinion, I think that networking is ultimately what gets you a job in the future, and kind of what impression you make upon others when you're talking to them is also a strong factor. I think coming into pharmacy school, one of the biggest pieces of advice that I got was don't burn your bridges in pharmacy school, or in pharmacy in general, because small it's a very small world in pharmacy. So that would be one piece of advice. Second piece of advice would be networking. I think networking is also very important because um, it kind of helps you better understand what you want um, out of a future, I guess, job provider would be the word, and kind of who you would want to work with in the future.
Ryan, can I add something else?
Mm.
Yeah, I would say the other thing, if you're able to, is to see if you can find a good pharmacy mentor. Um, I think, I've had some good mentors, that have helped me along my path, and so I think there are a lot of pharmacists out there who want to give back. I think in order to do that, right, you have to be a proactive mentee. So that means like not waiting for the mentor to kind of reach out to you and check in with you. Um, most mentors are okay with you reaching out to them and you checking in with them and asking them for advice. Sometimes they don't know how to help you unless you let them know. But I think if you're able to find a good mentor, and you can have more than one, right? That's like there's no limit on how many mentors you can have. And I think that's good because I think that also helps, like if you're somebody who's like, oh, I'm like afraid to network, like Nancy was saying, like networking is important, right? Networking is pretty big. And so I think that's something that just by you getting to know this mentor, right? That's like you practicing some of your networking skills, and then they can introduce you to other pharmacists that you can continue to build that network of yours. So I would say that's one other piece of advice I would have for pharmacy students.
All right. Again, thank you so much for the great advice from you, Dr. Hata and Nancy, and thank you both for taking your busy time out to get on this show and share your story and experience. To our viewers, hit the like if you enjoyed it. Comment down below for things that we have done well and things that we can improve on this show. Click the subscribe button and the notification bell for our latest content. Go give a follow to our Instagram and Twitter show and show us your support. And thank you everyone for watching. We'll see you next week with episode number 2.